3, 2.
And welcome everyone to the Real Leaders Podcast with keys from keynote speakers here at the Agents of Change Summit. I'm your host, Kevin Edwards, and joining me today is Kristin Carroll, the CEO of Rescue Agency. Kristin, thanks for being with us today.
Thanks for having me. Thanks for being here.
So the AOCs, what excites you most about this year's conference?
So the Agents of Change Summit is something that we look forward to every 2 years. Rescue Agency produces it, and it's an opportunity for us to bring together leaders and luminaries from the field of public health, which most of our audience actually comes from, but also from media, technology, from health systems and technology companies themselves, who can actually share innovations, case studies, best practices, and even their challenges around how do we solve some of our nation's most pressing health challenges.
So what's maybe different about this conference versus, say, your ordinary public health conference?
Sure. One of the things we really try to do at this conference is make sure that we're not actually just speaking to ourselves. You know, public health conferences do a great job of sharing a lot of their strategies and sharing a lot of their work on a day-to-day basis. But what we sometimes find is in a public health conference, we often are talking to our public health peers, right? So when we try to create change, we're talking amongst people who are actually saying, yes, I agree with you. But we're not talking to the policymakers or the technology companies or the health systems that could actually help us enact change faster. And so what we try to really do is kind of bring together a really diverse group of leaders and a diverse group of people who are all committed to doing something differently and just want to learn how, network with new people, and figure out how to kind of approach some of their day-to-day issues a little bit differently.
Yeah, I feel like a lot of the guests that we've had on the show are covering the topics in different ways, but they all have a unique background in that topic. For instance, the CDC was with opioid use, as well as we had a journalist who had covered the border. So how important is breaking down these silos to have a nice concerted conversation around a specific topic to create that change?
Yeah, I mean, I think it's actually mission critical to what we're doing at Agents of Change. So we've been really careful to curate people who have very strong opinions, are very passionate about the work that they're doing, but that are coming at it from different angles. And you'll even see, like on one of our panels earlier, we had some conversation around mental health and the prevalence of mental health. There was some agreement, and then there was also some challenging of each other, and that's actually really healthy, right? Because it gives each other an opportunity to learn from each other and bring together different perspectives so that we can actually do more when we're out there campaigning on Capitol Hill or working on strategies in our technology company, for example.
So what's the process behind getting these speakers into this conference? I know it's a lot, it's a 2-year conference. You've had a lot of time to put some thought into who is going to be presenting. What's the process like, and who do you consider to be legit?
Yeah, so that's a great question. It is a process that we start probably about a year in advance. One of the things we really try to do first is kind of think about what are we seeing in our culture, what are we seeing in the challenges that our clients have in putting together public health problems or public health challenges in programs, and what are we seeing that could actually be an undercurrent. So we kind of set the theme. This year our theme was breaking down behavioral silos for the complexity of human life. So you hit the nail on the head with breaking down silos. What we see is that there's just so much that we need to deal with in a public health environment. We generally see that people are addressing tobacco control or opioids or substances, or they're addressing obesity education and nutrition education. And the problem is that if we look at things from just one angle, we sometimes don't recognize that there's entire context around what that looks like. So that theme kind of set us on the path for what are the most important things for us to learn first, and then how can we create a crescendo of speakers that really kind of build on each other. So Jeff this morning talked about applied empathy and the idea that we really have to understand and empathize, walk a mile in our participants and our consumers' shoes before we start creating programs. And then we talked about community resilience, we talked about mindfulness. All of those things were really intentional. We had a panel this afternoon that was about mental health, right? So we know in public health that we can't actually solve physical health problems without really understanding that behavioral health is an undercurrent among all of the physical factors. And in fact, all of our panelists talked about how 1 in 4 Americans has issues with depression, anxiety, or mental health, and then yet all of them agreed that it's actually not a 1 in 4 number. It's much, much more prevalent than that. All of us have dealt with it, either personally or with a loved one. And so that was something where we really intentionally set the stage for the conference with really thinking about mental and behavioral health before we can actually talk about the other issues, so that we can think about the entire person as we put together public health challenges, public health programs, excuse me.
Right, yeah, the integrative approach, I think
Right.
was what fascinates me most about mental
Exactly.
health. So is there a specific speaker or person or theme this year that excites you the most that wasn't in the former AOCs?
Yeah, well, today is an exciting day. I shared with you some of the morning. I'm really excited to bring National Recreation and Parks Association to this summit because we work with a lot of public health agencies, but the NRPA is actually a group that has parks facilities in communities all over the country. And so they have real estate, they have locations, they have people that we can engage and kind of be a part of. This afternoon, we've got Dan Heath, who's a best-selling author, and he actually reached out to us and said, hey, your summit sounds really interesting. I am launching a book in March. It's called Upstream, The Quest to Solve Problems Before They Happen, and I'd like to come. Well, oh my gosh, like we were so happy to welcome him and allow him to kind of share his stories. He's got some stories that are relevant to public health, but really societal, right? How do we discover and find problems and solve them before they actually happen?
It's an interesting take, and we're looking forward to having him on the show as well. But I think our audience might be thinking right now is like, what is a behavior change marketing company doing hosting this conference? Maybe explain to our audience what a rescue agency believes in and the importance of having these leaders here today.
Sure, absolutely. Well, Rescue Agency, we're a behavior change marketing agency. So we work exclusively with partners who are trying to shift behaviors. Our mission as a company is to make healthy behaviors easier and more appealing. And we do that in many different ways. One of the things we find when we work with our clients, they're nonprofits, they're public health agencies, increasingly they're health systems, is that they're looking for new innovative ways, because we know a lot of the strategies that we've used to try to improve health really haven't worked, right? We're not in a better place today than we were before. We talked this morning about how just in the past 2 years, for the first time in over 100 years, the life expectancy of an American actually decreased.
Really? Wow.
It's starting to go back up this year. We just got some early reports, but that's not where we should be for the developed country and the leader that the United States is, right? So if our strategies aren't working, we as a behavior change agency really have tried to figure out, well, how can we bring together the best in the field, the best in the business to kind of share their strategies, what's working, and how can we create change in all of our areas of work so that we can move at a faster pace.
Got it. So we had a question coming in. I had reached out to a few of my friends here who have been affected by substance use disorder. And so I do have one question for you that I want to read off, and I want to make sure I don't get this wrong. It was around societal change. And so I thought you drew an interesting parallel from societal change versus the actual person itself. Let me just find it here, Kristin, while I'm doing a live interview with you. And this is
Sure.
perfect.
Well, one other thing that I'm excited about for tomorrow is we're bringing together leaders from technology and from media. So at the same time, we have all these amazing folks really steeped in public health. We've got folks from Snapchat and Twitter and Facebook, and we've got folks from organizations that are going to share with us how, like, Planned Parenthood is using technology to connect with people, or how the Gates Foundation is using creative messaging to connect with people on really complex issues. So we're really excited about some of those examples of using technology and using media environments to communicate a message at a much broader level as well.
And that was his question essentially.
Cool.
What's the difference between like societal change versus like the inherent like down to the person?
Sure.
Like what is Rescue Agency doing in terms of your research that's going to reflect in a commercial that's going to be seen by the general public?
Wow, there's so many ways to answer that question, but I think it really goes both ways, right? So at Rescue, one of the things that we always really focus on is we start any campaign, any behavior change program from the person who we are looking to help and or change. And we're really looking to figure out not how do we tell someone what to do. I mean, generally speaking, everyone wants to be healthier, right? That's a common universal human truth. But we're trying to figure out how we can understand the barriers that people experience, the things that are in the way of those healthy behaviors, and give them a nudge or give them support or give them resources or give them a path so they can actually become healthier. So we always start with research at the human level. So focus groups, we go out into communities. I got a comment just yesterday, actually, from someone in a public health department who said, you know what's so interesting is that at the same time you're doing all your work, I see you guys in the community all the time. You're with the people that you're serving, and that's absolutely right. So our researchers are out in the community. We don't create campaigns from our office, right? We have to really understand what's happening and what the environment around the people we hope to change really looks like. So doing that research helps us come from a point of truth and of empathy. But beyond that, we also are hoping to, well, how do we think about societal change and how can we bring together leaders? So all of our campaigns come from the human, but something like Agents of Change is all about, well, how do we bring enough people who are change agents together so that collectively we can all have similar ideas, we can all kind of have this rallying cry of we need to do things different and have some common strategies so that we can actually create change at a broader level at each of our public health departments and each of the communities that we serve, and hopefully there's that ripple effect, right? The change agents go out after being inspired and connected to all the folks here and can do more together.
And that's what I think really separates the AOCs from, say the other conferences we've been to, is breaking down those barriers and having that deeper discussion, which I find is so interesting.
Yeah.
But at a lot of the impact conferences we go to, there's always someone there lecturing about measurements. How do you measure your impact? So how does a rescue agency measure their impact? You mentioned life expectancy. Is that one? How do you measure impact, and what does that mean to you?
Yeah, isn't that the question that we all wish we could answer,
Exactly.
right? I mean, I think we look at things from multiple perspectives, right? So we know that there isn't one single metric that's going to suggest, like, hey, we have now achieved health. But what we do is make sure that for every campaign that we create, there's a logic model from an evaluation standpoint. Now, behavior change is something that we know takes years. And so that's one of our biggest challenges in the space that we serve, is that if we create a campaign or an intervention, we're not going to see change for a year to 2 to 3. Well, gosh, is it hard in today's environment to wait for a year to 2 to 3. And so we also bring the proxy measures that allow us to see progress towards those overall behavior changes. And that's actually one of the reasons why we've brought technology into the fold. Because what technology has done is it's given us an opportunity to measure things much more real time. Right? So we can launch a campaign and we can see how many downloads something gets, or how many click-throughs something gets, or how many times someone's watched a video, or how many impressions, engagements we've been able to create. We measure things in terms of awareness, which is just the existence of a message. We measure things in terms of active engagement, and we make sure that there's this continuum between awareness, active engagement, so that we can really understand if people are aware of something, exploring an idea, and or taking action on something. And so that technology has really helped us see the proxy measures towards behavior change.
This might be an odd question, but if you were to solve all the problems today, vaping, opioid epidemics, would your company exist?
If we were going to solve all of the problems, well,
Health problems today, which is a total not going to happen.
One of the things that we talk about is, as a group actually, is that if we do our jobs well, we actually move ourselves out of a job. And interestingly, tobacco is one of those things that we talk about in that way. The tobacco landscape, for example, has really shifted over the past even 3 and 4 years in dramatic ways, differently than it had over the past 15 and 20 years. So we've seen the lowest incidence of tobacco among 12 to 17-year-olds in the last several years than we ever had before, right? But we've also seen over the past couple of years that vaping has become an epidemic among young people. So it's a tool that was originally used for harm reduction to help adults quit smoking, right? Which seems like a great alternative to a combustible cigarette. But the challenge is that teens actually started using it and have become addicted to nicotine. So the skyrocketing vaping levels have actually created an epidemic of their own, which the environment around tobacco control has to manage. And for the first time in 2018, we measured the first increase in tobacco use rates among high school students than we'd seen in a decade.
Really?
And so while on one hand, we see that we can solve some problems, there are always, kind of scenarios and things that we need to be looking out for ahead to make sure that we can see those challenges in advance and or make sure that we can be prepared for the next thing that's around the corner.
And this is something that's really picked up some speed since the last AOCs. When you see all these reported cases, like what's going through your mind when you hear about a kid who is caught in the bathroom smoking a vape, and he's 14 years old.
Yeah, I mean, the interesting thing is that we have done countless hundreds of focus groups with teens over the past several years, 5, 10 years. And we've seen teens talk about vaping for 3, 4, 5 years, right? So when we actually talk to the audience and you're in the audience's environment, this is something that we could see in advance. But from a public health standpoint, public health wasn't really able to take action until they saw it in the data, right? Until they saw it on those, youth behavior surveys. And so what had happened then is that it immediately became an epidemic, even though there was a gradual increase over a period of a very short time, but a period of a few years.
So we're like the conversations, the high-level conversations right now about how to fix this crisis that's going on.
Yeah.
I was able to watch an interview that President Trump streamed live with him and Mitt Romney in the room with Juul and the other competitors, and they're all throwing their own company data at him, and they seem to think that there's going to be some black market problems if they banned it. And so what are some of the high-level conversations that you're having, and do you think there is a potential solution to really decrease the usage amongst high schoolers? Yeah,
well, I think, first, there's so many things that need to happen in order to, it's not one, single solution, but the way we approach the challenge is really thinking about it from a behavior change pathway perspective. And so the first thing we think about is what's the knowledge that teens and adults need to have in order to curb the behavior. So what do we not know that we should know about vaping? And so the health risks, the consequences of vaping really weren't well understood, right? Initially it was a harm reduction tool, so theoretically it was better than smoking, and that's what everyone heard, right? But yet there are real issues around chemicals and damage to your lungs and things that really only over time have become apparent. So really sharing that knowledge, that's the first thing that we are starting with. There are policy, scenarios, right? Banning flavored tobacco, those types of things are certainly an important aspect of it. And then ultimately, as we move forward, we'll be changing social norms. But, Rescue's work today, what we've done is that because we saw this coming, and because we didn't see funding from a public health standpoint actually come quickly enough, instead of waiting for our clients to actually have the money to create a campaign and go to market, we started creating what we call ready-made campaigns. And a ready-made campaign is we took it upon ourselves to go out, do some research, put together some formative ideas, concept test them, produce them, get the research and the formative background so that they could be evidence-based strategies, and then we now allow clients to license or buy into these programs so that they can very quickly, the moment they get funding, instead of going through a 6 to 12-month process to create a campaign, they can immediately put a public health intervention in market.
Wow.
That's been something that's been really, really important. We're also working with youth in Virginia, Louisiana, and New Mexico on policy initiatives. So in New Mexico this week, actually, there's some tobacco licensing laws that are going to be going into effect. And previously, they would have only actually focused on typical tobacco, and they may actually include e-cigarettes and vaping as well. So from a policy initiative, we have students on the ground in New Mexico that are working on creating licensing laws in a way that's actually going to protect more students.
How do you, now that with this legislation, how do you take on or create legislation for a tobacco company that also owns a vaping company?
Can you say that again?
Yeah, I guess for legislation, right? So if what would you say to a tobacco company to create policies against vaping if they own?
Yeah, so we don't work directly with tobacco companies at all.
No, right.
So
the legislation part, that
yeah,
I guess
the legislation, really happens on its own path, right? What we do and what we've done in New Mexico, just as a point of example, is that we've worked with students in New Mexico for a period of 5-6 years where we recruit in schools leaders who can become tobacco-free advocates. And we train them to understand the tobacco landscape and how teens have been targeted and how tobacco harms their communities and their environments. In New Mexico in particular, we've been working on 2 specific policies. One is called 24/7, which is creating 24/7 tobacco-free schools that includes vaping as well as cigarettes. Schools are 24/7 tobacco-free, morning, evening, on field
Just
trips,
everything.
with guests, with teachers, all of the above, right?
Got it.
And that's actually something that We also worked on in Virginia, and they passed last year with Governor Northam a 24/7 tobacco-free law, and we put that into effect after Rescue had been working with their teens and their students for a period of 4 years. But we worked on 24/7 in New Mexico, and then we've also been working on a campaign called No Minor Sale, which is all about tobacco licensing.
Okay.
And that's where it comes back to your question of like, well, how do we, impact the law? Our job is not to lobby. Our job is to help educate the public about licensing and how it is important for their community. So with better licensing laws, fewer teens have access to tobacco. And with better licensing laws, fewer teens will use tobacco, including both cigarettes and vaping. And so we come at it from a purely education and citizen engagement model. And ultimately, the legislative environment in New Mexico is one where now they're actually moving in that direction, and we can help move forward those conversations, and our students are there front and center.
Okay, got it. Thanks for helping clarify that for me.
All good.
I think it was a little misunderstood. But all in all, this is going to take a lot of leadership to do, whether it's at a government level, private level, public level. It's going to take a lot of leaders like yourselves to make this change. So last question I have for you, Kristin, is what is your definition of a real leader?
My definition of a real leader, I always find that a difficult question to answer, but as evidenced by all the folks that are here at Agents of Change, everyone here is looking to see a problem and identify a problem and try to come up with solutions before those problems become even bigger issues. So really be ahead of some of the things we know to be coming and being willing to kind of go out of our comfort zone, learn something and reach across the aisle or break a silo that may be in front of us so that we can accomplish something that hasn't been done before, because we know that what we've been doing so far hasn't actually gotten us to where we want to be. And in our mind, that is an environment where everyone has access to healthy behaviors and is able to live a happy and healthy life.
Kristin, great answer. I enjoyed speaking to you today. Thanks for coming back on the show.
Happy to be here, and we're thankful that you were able to come to Agents of Change. What a great opportunity to showcase a different type of real leader, right, in our environment.
Absolutely.
So thank you for coming.
Well, we talked about a lot today. We talked about the AOCs, what's changed in the past couple of years, all the way down to rescue agencies' research, and how do you take on these problems? Would your company exist if these problems didn't exist as well? And then we tied it up with some leadership lessons at the end. So I just want to thank you for your time, Kristin.
You got it.
For Kristin Carroll, I'm Kevin Edwards, asking you to go out there, do your research, folks, be immersed in your own communities, make sure that you're inspiring change, and always, folks, keep it real.